Test, don't guess. This is very, very important for you guys to understand. Hey guys, Dr. Nathan Warren here, and I just want to take a minute to go over something that I talk about with patients all the time, and that is test, don't guess. We live in a world today where we can test and see how well your body is functioning, what may be some of those yellow flags before they become red flags, and what are those things that are showing up that are those red flags that you have to address right away. So we recommend getting something called the Basic Wellness Panel done. When it comes to getting blood work, here's one of the biggest things that I get on a regular basis. Dr. Nathan, I get my blood work done at my doctor's office once a year, because my insurance covers it. Let's be very, very clear about something. If you are relying on your blood work that you're getting once a year or even twice a year in your medical doctor's office, you are missing out on some of the most important things that you need to look at when it comes to your health. I promise you this. I've looked at blood work from just about every single patient that comes into our office who have gotten it done through their medical doctors. And I'll tell you right now, they are missing so many important things. It's almost laughable, except for the fact that this is dealing with somebody's health and somebody's life. So you guys are going to have to take control of understanding your body, your wellness panel, and your blood work. So this is what I recommend. I recommend that both men and women get a wellness panel done at least, at the bare minimum, twice a year. But what would be even better is a quarterly draw so that you can actually develop patterns and see exactly what's going on inside of your body. Listen, we know that things that are most important to your health are overlooked in your typical blood work, and I want to go over some of those right now. We know that most will run a complete blood count. Most will do a comprehensive metabolic panel. We know those are going to be running majority of your blood work. But then we start missing some major pieces. For example, when we look at thyroid function, which by the way, we know that there's well over 100 million people estimated in the United States that have a subclinical thyroid issue, and your doctor is not running the appropriate labs. I promise you that. We have to look at a full spectrum to see what's going on with your health. Things like TSH, free T3, free T4, reverse T3, and here's the ones we see skipped the majority of the time. Those are going to be your antibodies to see if, hey, is your body having an autoimmune type reaction and actually attacking your thyroid tissue? We know that about 54% of our population in the United States has underlying autoimmune conditions going on, and the thyroid is a major one for that. Homocysteine, again, a big one to check what's called methylation. If you are not methylating appropriately, every cell in your body is at risk of dysfunction. I shouldn't say is at risk. It is dysfunctioning. So we need methylation, again, to be able to properly remove toxins out of our cells and out of our body. And so if we do not have proper methylation, we are getting constant hits to our DNA. We are damaging our gene expression, and that is not a good thing at all. Vitamin D. I can't even believe I have to say this, but again, the majority of your quote-unquote wellness blood work you get ran through your insurance or through your doctor does not have vitamin D on it. Guys, we know vitamin D is not only amazing for your immune system, but vitamin D is actually involved in well over 2,600 processes dealing with gene expression. This is vitally important. If you do not know your vitamin D levels, you are really playing with fire there. And so I recommend getting your vitamin D levels checked. Vitamin B12, this is a big one. Again, that goes along with thyroid function, your nervous system, brain function. And again, you'd be absolutely surprised about how many people have deficiencies in vitamin B12. And you've got to be very careful with this one, because if it shows above the range, high above the range, or greater than 2,000, that can also mean deficiency. It means you got a lot in your blood, but it's not getting into the cell to be utilized. Things like insulin and C-peptides, checking that fasted insulin and C-peptides. I guarantee your doctor's not running these, and these are phenomenal metabolic markers to see if, even though your blood sugar may be quote unquote normal, you could still be pre-diabetic or even in that diabetic range and damaging the function of your cells based on fasted insulin and C-peptides. It's going to be very, very amazing functional markers to look at. Lipid panel, and actually checking far beyond just cholesterol number, right? Being able to see those triglycerides, looking at certain ratios that are going to be very, very important as well. Then checking your iron and seeing what that looks like. And ferritin. Ferritin can be a very big marker of infection going on inside the body. So we actually like to look at ferritin as a clue into, hey, maybe your body's right now fighting off something that it needs some support with battling. And then things like free and total testosterone, we definitely check that in men. And looking and seeing exactly what's going on in that area, because as you guys know, you men out there, testosterone is a major one. We see it very low. I've even had people in the 100s, the 200s. And again, I promise you this, if you don't know what your number is, you don't know how to optimize it as well. So these are going to really give us a great idea and understanding as far as what's going on with your health. One that I didn't mention in here, C-reactive protein, is vitally important as well. We actually know C-reactive protein is an inflammatory marker. So not only is it important to know for the overall health of the heart, but C-reactive protein is going to be a big one to know as far as the overall inflammatory levels going on inside of the body. Actually, I'll give you one really quick idea. There's been several studies looking at things like, serious infection with COVID-19 and those entering the hospital, and see a very, very high correlation with higher C-reactive protein. So understanding how much inflammation, how much fire is going on inside of the body and at a cellular level is vitally important to your overall health. How much would you like to know if you're more at risk of having complications from a virus, if you're more at risk of having complications from other types of chronic disease, if you know something like your C-reactive protein? So this is why we have these run in our office. This is what my patients do on a regular basis. This is what we do on a regular basis, so that you can be in control of your health. Again, if you are relying on your insurance and if you are relying on your doctor to run your blood work, you will be lacking in the proper information to be able to discover how healthy is your body and what do you need to do about it, or how healthy is your body and how can we optimize that amazing health that you're dealing with right there. So again, make sure that you can go on and you can actually check out on our website, drswarren.com, and we have a link here in this email that you can actually check out as well with the basic wellness panel, and you can find out more information there.